Welcome to ComSpark TV. We are in Columbus, Ohio today, and I'm Bryan Kaiser, President and founder of Vernovis, and also part of the Executive Host Committee for ComSpark. We are here today with Linda Stevenson with Fisher-Titus Health.
Yep.
Thanks for joining us today.
Thank you. Thanks, Bryan.
Appreciate it. So you're new in your role, 7 months as CIO.
Yeah.
And a CIO role is very challenging in and of itself, but you're also in healthcare.
Yep.
So why did you choose healthcare?
Well, really for two reasons. I kind of knew from the very beginning of my career I wanted to be in healthcare, and I think because there's purpose behind it. It's not like any other industry where you get up and at the end of the day you're making a widget or providing just any service. You're providing life-saving services. And I think that in and of itself makes you really want to be there in the morning to help make a difference to a patient. Beyond that, I think the people that work in healthcare have a unique personality. They're caring. They want to do better, and I think that really drives us every day. So I could be a CIO in a lot of different ways, but there it makes you want to get up in the morning.
That's great. So being new in a role, what are some of your goals as the CIO?
Whew, boy, that's a really loaded question. But the first thing I need to do in my organization is take care of the people. They come in every day wanting to make an impact, but sometimes history has put them in a place where they're really struggling with that, whether there's projects or too much work. So I have to kind of come in, work with them, mentor them, make sure that they feel cared for and that they've got the resources that they need, evaluate staffing and get them those tools so that they feel that they can make a difference. Changes over the years have really allowed them to maybe suffer a little bit, not really do their best, so that's what I'm there to do initially. Beyond that, I really want to focus on optimizing and taking advantage of all those people who invest a lot of money in technology. And if we don't optimize that technology and make sure they get the benefit and the goal, achieve the goals that they intended with that, they're not going to have that trust in information technology. They're not going to have the trust in our people. So optimizing and really getting the benefits of the tools.
Great. And so I would imagine impacting change or impacting the organization for change to come is part of your leadership that you need to deal with. What are some things that you're considering doing from a impacting change and culture standpoint?
I think one of the most important things to do as you're going through change like that is to partner. Whether it's partnering with leadership, clinical leadership, physician leadership, financial leadership, making sure that you come at it as a team to make sure that we look at goals together, that information technology can support those goals that they have in mind. But then also, especially for Fisher-Titus Health, we're a small organization and probably one of the few standalone hospitals left. It's really rare right now. So we need to also partner with other places, other hospitals, other CIOs I partner with to make sure that we kind of look at best of breed, look at best practice, and how can we together as a group do better.
So that's a good segue. You talk about partnerships. Mm-hmm. Are these formal partnerships for CIOs? Are these informal? Like what does that look like for your sphere?
Sure. It mostly informal. However, there are some ways in which some of these smaller hospitals are trying to partner together for maybe group purchasing, things like that, but mostly informal in terms of us meeting together on a regular basis saying, what contracts are you dealing with and what problems are you trying to solve? And maybe one hospital's tried to solve something that I haven't and vice versa, and then we exchange templates and ideas and also kind of plan together, okay, in the next 2 years, we're all going to need to do a new general ledger system. How can we work together to see if we can get a benefit there?
That's great. So are these monthly meetings, they lunches, are they, hey, let's get together as a group of 10 people, 8 people? Yeah. What is that?
A little of both, okay. Actually. Sometimes it's informal, hey, we need to have a conversation, let's get on a call. But we try to have maybe quarterly meetings on a regular basis and plan out exactly where we're going to focus at those meetings, make sure we round at each other's organizations so that not one organization has the burden of organizing it all the time. And I think it's been a really great experience to be able to learn from each other and plan together.
That's great. So what do you think an aspiring CIO, what type of skill sets or attributes should they be honing in on or working on?
Yeah, I think that's changing. I think in the past, the CIO was focused on technology, understanding of firewalls and network infrastructure, maybe somebody about who you can program. I think now it's a little changing to be more of a business acumen. My background, I started in billing many years ago, and I've had the opportunity to really get exposed to all areas of the hospital through regulatory, whether it's HIPAA, meaningful use, any other regulatory exposed me to everywhere. So having that big picture, being able to communicate well, those I think are the things that are changing now to be so much more important, because if you can't understand their needs, how can you partner, strategize, and then get the value for them if you don't understand what that value is?
That's good. So as you look into the future, the next 12 months, what are your top 3 initiatives that you want to try to tackle?
Sure. I think the top initiative, number one, is, like I mentioned, partnering not only with other CIOs and organizations, but partnering with my leaders. How can I work one-on-one with the chief nursing officer to march down the path of what she needs and how we can bring value to her through technology, whether that's optimizing nursing workflows, saving time and productivity, or patient safety. How can we bring tools to bring more safety, life-saving safety to our patients? Another goal would be to right-size my organization, make sure that we have the right staff in the right places. Small organization, small amount of information technology staff, but that doesn't necessarily mean they're all have the education they need, the experience they need. So providing that to my team. And then I think doing better at communication. Anytime I can bring tools to the table to make sure that the value and benefits of our tools are achieved. And that's a partner, again, with IT technology and with the business side of things. So if I put a tool out there, that doesn't mean just putting the tool out there is going to work. How can they take the workflows to the next level, make the change necessary? So it's about that change management, helping them see that.
So it goes back to change management. So,
it does.
So I might say a bad word here. So cybersecurity, what are you doing from a change management perspective there?
Yeah.
What are some pitfalls that you might want to make sure you don't step in?
There's a lot of cybersecurity work going on. I think first and foremost is to make sure you have a good base security management program, including your administrative, your policies, your procedures, making sure people are educated, because if they're not educated, there's so many ways to slip up and those opportunities, whether it's phishing or things like that, they need to know. And then beyond that, making sure infrastructure, and I don't know if you can even segregate infrastructure and security anymore. They go hand in hand. A good core network infrastructure, servers are patched, and all the technology layers. So we're implementing a more robust security committee that's comprised not just of the technology leaders, but compliance, the administrative side of things, so that we have the look across the continuum.
That's great. So you're getting people from all walks of life within the organization touching cybersecurity, which I think is very smart.
Yeah.
And we could unpack that for a probably 30-minute
Absolutely.
segment. So we are out of time today. Thanks for joining us, ComSpark TV. You can join us at comspark.tech for more information. This is Bryan Kaiser with Vernovis, with Linda Stevenson with Fisher-Titus. Thank you.
Thanks, Brian.